sacred art.
Welcome to the Echo Podcast, where every story has a source, every calling has a cost, and every transformation leaves an echo. So these conversations are meant to uncover essence, which to me is the magic behind what makes us unique as business owners and as human beings. So business is not only about the bottom line, which is important, but it's about the stories of healing, the successes, the failure, the heart, which is why I believe that business in itself is a form of sacred art. So today I'm sitting with Dr. Matt Eichen, a chiropractor and someone whose hands have brought healing to so many people who have suffered with various types of injuries and chronic pain. So Dr. Matt, thank you very much for joining us today. Why don't you just introduce yourself and give us a quick glimpse into what it is that you do?
Sure. My name is Dr. Matt Eichen, as you said. I have been in practice since 1997. Moved to South Carolina in 1999 and practice here in Mauldin, South Carolina.
Excellent. Thank you for that. Now, I'm anticipating that our discussion is going to maybe lead us into some uncharted territory, which is great. We don't know, but I'm assuming that it will. But I don't want to jump right into your practice. I kind of want to go back a little bit. I want to start at the beginning. So think about a movie. There's an opening scene, which plays into how the rest of the story unfolds. So for you, let's go back, all the way back to your childhood. So before the practice, before the patients, before all of that, what was the kid version of Dr. Matt like? Just let me get into your mind a little bit on that.
Yeah, I was raised in the Midwest. I was born near Chicago, grew up in mid-Missouri, had a wonderful family background. I played a lot of sports. I was in band. Like a lot of kids in the Midwest, just had a great time with growing up in that area.
We have a lot in common, I'm finding out. So you were in band.
That's right.
You also were a wrestler, as we discussed.
Yeah.
What was it that drew you to music? Was it your choice to play? Were you from a musical family?
No, I just really looked forward to the experience. I really wanted to try everything. And so band really, I really enjoyed music, and I got involved with playing percussion and the snare drum and band. Really enjoyed the people I played with, and it was just a great experience for me.
Yeah. See, when I grew up, my grandfather was my music teacher. So it was almost assumed that I was going to play music. The interesting thing about music, though, and which is why I asked about your childhood, is this took me a long time to realize, but playing music for me became a very technical thing. I practiced a lot, obviously, because there were things that I was practicing for. If I wasn't playing music, though, I started tinkering with watches. Totally random, but I have all these memories of me taking apart all of my grandfather's watches, putting them back together like Frankenstein, giving them back to him. He had no idea like why I was doing it. But I feel like there are these little clues that we get in our childhood that inform what the future holds, which are hard to see. Thinking through this whole Dr. Matt as a kid thing, I could see you in your marching band outfit. I don't know if you were in marching band.
Yeah, I was.
I was in marching band as well. I loved it and I hated it. But now, how do we get from that Matt to the Matt that's helping people? So is there a pivotal moment in your, doesn't have to be like you were 5 years old, it can be anything. When did you first know that you were drawn towards helping and healing people?
You know, I think my first experience, two things that happened in that time. I used to love to skateboard and was riding on a skateboard in my neighborhood with a friend of mine. And I guess they just repaved the road, and it was a lot faster than I was used to. And I came flying down a hill too fast and out of control. And I took a step, and the next thing that happened, my face just planted right on the ground.
Wow.
I literally felt several of my teeth just shatter. My chin just split open to
This
the
is
bone.
a real
I had
face plant.
Yeah, I had a very serious accident, and it was a terrible neck injury. And my friend called my parents, and of course I went to the emergency room. They did what they could, stitched me up, but I couldn't move my neck, for over a month. And so I went through the whole medical route, didn't really get any relief. And I can just remember laying in bed and not being able to sleep because I couldn't turn my head, and it was terrible. And this went on for over a month. And that actually is what led me to my first chiropractic experience.
And how old were you when that was?
I was 13.
You were 13,
Yeah, 13.
at your first chiropractic
Yes.
experience.
Yes.
Okay, what was that like? Tell me what
It
your,
was,
because you
yeah,
could be, that was the first time that you were on the
right.
other end of things. What was
That's
that
right.
like? Yeah.
Well, this would have been, I think, right around 1985.
Okay.
And at that time, chiropractic was still really on the fringe. So it was, I can actually remember the conversations that my family had. My mom decided to take me to a chiropractor, and I can remember a lot of the family members were like, I'm not really sure about this. It
Some
was,
hesitation.
yeah, very different from the norm. And, you know, at this point, though, I was suffering for at least 6 weeks, and I just didn't care. I was just, I need relief. And so when my mom took me, I was didn't really know anything about the profession. And I just remember walking into that office, that doctor treating me and walking out and being able to turn my head for the first time in over a month and had so much relief. And it was just
Wow.
an incredible experience. Now, at that time, I didn't really think, oh, this is what I want to do. But I just had a positive experience and it was great. And then over the years with wrestling, of course, I had more injuries. And so when that would happen, I would go back to the chiropractor, you know, for relief. But when it came to my college experience, I had a teacher. He was a wonderful man. He mentored a lot of students. He even was the principal when my grandfather was a student in the same high school. So he had
Wow.
been there forever. He was a really well-liked teacher. And I went off to college, and when I came home, I went by to see him just to visit. He lived right next to the high school there. And sadly, I found out that he had just passed away the night before. It was just that
The night
close.
before you went to visit
Yes,
him.
yes.
Okay. Wow.
And come to find out that he had diabetes. And unfortunately, his health had been mismanaged, and he had a cut in his foot. And they just didn't follow up properly. And it led to an infection. And then over a few weeks, he ended up passing away. And I think at that age, I was probably 18 at the time. And it was the first time I realized, you know, the Western medicine model isn't perfect. And it really made me realize that system failed him. And it made an impact on me at that age.
So that's a pretty formative age to have that realization because, in my opinion, you can't have that experience when you're too young
Right.
because you need some sort of maturity there to grasp what you're saying, which is a big idea to be able to say modern medicine, Western medicine, whatever it is failing or there's something we could do better or something that we're missing. That's a big thought to have even at that age.
Yeah.
Do you was that a moment for you that you felt like you were on a mission? Was that a pivotal moment?
Not
Or that was
yet.
your first touch with that?
First touch. Yeah. And it was just an understanding of, I couldn't believe it happened, that they had just unfortunately let him get more and more sick and missed it, you know.
Yeah. So now how much time passed between that moment and then you formally studying?
Another year. And so I went into my second year of study. I was actually studying business at the time. My family had a very successful office equipment and furniture business, and they sent me to college. My grandfather started the company, and my dad and my uncle were also part of that and very successful and passionate about what they did. And we were all very close. And the idea was to send me to school, to the same college my dad and uncle went to, and that I would follow in their footsteps. But during my sophomore year, I just realized that I just felt lost. I just didn't enjoy my courses. I didn't feel like I was headed in the direction that I really wanted to go in. My mom contacts me at school. I lived about 3.5 hours away. And she said, I'm thinking about going back to school to become a chiropractor. And my initial reaction, it was still based on the views that most people had of chiropractic back then. It was still kind of a fringe profession, really wasn't accepted by everyone yet. So at first, my thought was, I'm not really sure if that's a great idea. And we decided to meet in St. Louis to tour the campus that she was looking into enrolling. But my real reason for going was not only spend time with her, but I was going to try to talk her out of it. That's why I went.
Okay.
Yeah, so I ended up going up to St. Louis. We spent the time together, went to visit Logan College in St. Louis. I ended up meeting actually some really great guys on the hockey team there, really great guys. And they were very different than what I remembered from my chiropractor, who was a little bit different. And I thought, well, these guys are really interesting. They're a lot of fun. And they were telling me about their experience there. And I thought, well, this is interesting. So I took home a lot of literature from the campus about the philosophy of chiropractic, the history, and I took it back to my dorm and I started to read through it. And I found myself really drawn to it. And I thought, this is really exciting. It was not what I expected. And after about 2 months, I actually called my mom and I said, you know what? I think I want to do this with you.
Did you say false alarm?
Yeah.
You keep going, I'm coming with you.
Yeah. And that's exactly what happened. I took
That's
my
amazing.
final exams on a Saturday, moved from Springfield, Missouri to St. Louis on a Sunday, and I started my pre-med studies on Monday. And that was that fast.
Wow.
Yeah.
So that seemed like a pretty obvious open door. There's a smooth transition into a new thing. And I mean, look, you know when you're not in the right place sometimes in life. It's just you feel the friction or your heart's not in it.
Right.
That's totally fine. But I think the blessing of that is like you did have this experience that brought you on this path that you didn't even really know fully why you were on it.
Right.
And I like the tension of wanting to call mom and say, hey, don't do this. This is not the best idea. But it's also interesting that the personality of these people on the hockey team and all these other things that are maybe on the fringe are kind of what brought you in. It's that vibe that you're just kind of feeling out like this isn't that bad. But how it turns out is you get in, it's seamless, you start. So now you're officially in this world. There's this big monumental change and you're on this path that you still don't know exactly how it's going to unfold. So now you're officially in the world as a healer, as a helper, as a chiropractor, and all those ways. Tell me about your first major experience as a chiropractor.
Well, that goes back to my first year of study. I was still going through the basic requirements, learning about anatomy, physiology, and about chiropractic. And I had heard about this Dr. Rob Kessinger in Cape Girardeau, Missouri at the time, who was a knee chest specific chiropractor. It's a very specific form of chiropractic care.
Is there a way you could explain that in a nutshell?
Absolutely. It really focuses just on the top of the spine and the neck and the adjustments to that area, which are a very powerful way to heal. And we can get into that later.
Sure.
And he had a very successful practice. And we went on a weekend on a Saturday to meet him at his office. And he was so kind, came in on a Saturday on his day off, spent 3 hours with us, talking to us about the profession and his experience and this technique that was very specific at the time that I had some interest in. I'd heard some interesting things about the work he was doing, the kind of cases that he was treating, and it was far removed from just the normal neck and back pain that most chiropractors were treating. And he had a mentor named Dr. Michael Kale, who actually practiced here out in Spartanburg, South Carolina, who was really the top of the profession. He was regarded as the best in the world at this technique that Dr. Kessinger also practiced. And so I had an interest, but it was a lot to comprehend at the time, and I was still very new. And so I went through a few more years of study, but I kept remembering what Dr. Kessinger had shared with me about this work. And I just kept coming back to it. It was so unique and special. And as I got further and further into my studies, what he had told me that weekend just made more and more sense. And I began to want to study this work. And so a few years later, I actually came here to South Carolina, met Dr. Kale, started to attend the seminars that he would teach doctors and students this work that he did, and developed a friendship with him, which led to many things later on.
Yeah. So is there something that you could put your finger on that makes you want to go deeper in this field? Because like you're in chiropractic, you're studying, you're learning, but to look at these very specific methods outside of the box or whatever that might be in your field, what drew you to that? Is it just pure curiosity, or were you starting to see there's something really special going on here in this field?
Yeah, he was a very dynamic doctor. He was just an incredible man. And as I was going through my studies in chiropractic, we would have doctors that were in the field that were successful in the technique that they used or the type of work that they did. and they were all great, very interesting. And they would bring case studies and teach us the type of work they were doing. What really drew me to Dr. Kale and the work that he was doing with this upper cervical specialty is the type of cases and the difficult nature of them. And I remember most of these doctors, after about a 30-year career, they would have, maybe a half a dozen of these really great case studies that they had. But when I visited Dr. Kale, he was seeing those type of cases every day. And it was just a whole nother level of practice I'd never been exposed to. And I really wanted to do that. I was really drawn to that work.
The connection that you had with Dr. Kale was on that same level. He may have been ahead in years and experience, but you both are like, we want to drill to the deepest level of this field and learn everything we can, be as effective as we can. And that heart was like your connection. And it's that thing it's unspoken. You can't put words to it, but like, why am I drawn to this person? And that's just great that it happened to be that guy that you were drawn to.
Yeah.
And it sort of all makes sense from that perspective. So now moving on to you as someone who's actually laying hands and treating. Tell me about your first major treatment that you remember that you did with your hands.
Well, that was actually with Dr. Kale himself. And so this would have been approximately 1996, early 1997. I had actually come out here. He had offered me a position to work with him in his research center, and it was the only chiropractic hospital in the world. It was a 24-hour chiropractic facility. It was really unique in itself. And I came out here to visit him and look for a place to rent out of school so I could begin to work here in Spartanburg with him. And we were in his car. He had a Rolls Royce. He was a very successful chiropractor. He had a lot of flair. And we were going to go up to Hendersonville to visit a good friend, Dr. Dalliers, who had also worked for him. And he was sharing with me his life experience. And he had a very difficult background and childhood. And he was telling me about his struggles and what he had worked through. And it was the first time after getting to know him all these years that he had really shared with me some personal experience. So it was a very interesting moment. And after this conversation, he just got very quiet. And we were driving along. He didn't say anything for about 20 minutes. So I just listened, and we got to where we were going, and come to find out he had a heart attack with me in the car.
Did you have any idea that something was wrong? Because we've all been in the awkward silence in a car with somebody.
Right. I had no idea what
You
was
don't
going.
know what to think. So you had no idea.
Had no idea what was going. So, but he just gets to Dr. Dallies' home and collapses. And they start working on him, and I'm watching all this. I had no idea what was going on. And
Wow.
so at that time, I was studying in Houston, Texas. That's where I finished my degree. And it was a 2-day drive to get back to Houston. So I make my way back. And by that time, he had actually been flown on a flight to Houston, Texas, to be a patient of Dr. DeBakey, who was the top cardiac surgeon in the world. He invented the heart bypass operation, and he was his cardiologist. So we go back to Houston, and by the time I get there, he's already had open heart surgery. He's in Dr. DeBakey's hospital in Houston, and while he's recovering, things are not going well. And his wife, Charlotte, calls me, and she says, "Dr. Eichen, I need you to come to the hospital immediately. His heart's not in rhythm. His pulse is too high. We don't think he's going to live through the night unless you come here and try to do this work for him." And I was just floored. And I said, "Charlotte, I'm still a student." I was 23 years old at the time.
So were you trying to get, and this might sound horrible the way I'm saying, you weren't trying to get out of saving a life.
No.
But were you trying to figure out a way
Yes.
to get out of the situation for obvious reasons?
I was terrified. Terrified. And I told her at that moment, I had just been studying this work and theory. And so while I was learning the regular chiropractic methods and I was pretty competent with those, I had never done this actual procedure. I'd never actually tried to deliver the adjustment on anybody yet. And so I'm trying to explain this to his wife, and Charlotte says, "Dr. Eichen, you're the only doctor in the whole state of Texas that's even attended our seminars, that even has a clue of what we do. You're the only one that can help." So you can imagine how I felt. So I drive down to this hospital, And it's an amazing facility. I mean, there's literally a statue of Dr. DeBakey donated by the King of Norway as you walk in. I mean, it's like the Mecca of medicine. And here I
Yeah.
am, this chiropractic student, and this is the situation. There's the princess of Saudi Arabia as a patient in the room next door. And here's Dr. Kale laying in recovery, and we think he's dying. And she says, "You're our only hope." And I'm just unbelievable.
And just for more reference for you,
Yes.
how old were you in that moment?
23.
You were 23
23.
years old.
Yeah. Yeah. Very green. Very
Very
young.
green, but also to be in that situation at
Yes.
that age, you're kind of operating on obviously pure adrenaline, but you're operating on this idea that you have to have some level of faith, although you're
Yes.
scared.
Right.
I mean, it's like there's only
Yes.
one person who can do this. It's
Yeah.
you, and you're
Yeah.
green, and you're like, what is going to happen?
Mm-hmm.
Obviously, you were nervous. Obviously, you were probably very unsettled. But I want to hear what happens next. And when you get to the part of explaining what's happening, can you also give us some more of understanding of what the adjustment actually involves?
Sure.
Because that
Yes.
is really, really important.
Yes. So he was really an expert on treating the upper part of the neck, which is what we refer to as the upper cervical spine. And it's very central to our health because it's really where, think of it like the hard drive on your computer, kind of runs all the software, runs everything in the body. So our nervous system's designed so that our brain really controls all the functions, our digestion, our heart rate, our respiration, all the things you don't think about. It's really the nervous system, and more importantly, our brain and brainstem, central nervous system that controls everything. And this area is really central and key to all of that working properly. So that adjustment is very powerful because not only does it help people feel better, but it can really enhance and improve someone's overall health from that perspective.
Okay.
And so, having understood all of that, I go to the hospital and he's laying in the bed, and I get there, and then he's trying to explain to me how to adjust him. And I have to tell him, Dr. Kale, I've actually never done it. And the look in his eyes, he just was deflated. I could tell it was just,
Yeah.
what a moment.
And
But
by the way, he
it's-
was he may or may not have been expecting to see you to do the
Right.
adjustment, right?
Right.
And not knowing what was going to happen because you got the call from somebody else. Now you're here,
That's right.
and the hope that he must have had seeing you
Yeah.
all went away. I'm sure when he when he asked you that question.
Exactly.
But yeah,
Yes, it did.
Yeah.
And so I literally, I had to pick him up out of his bed and bring him into a room where his wife had put a portable table to
and
do
he's
this.
hooked up to things.
Oh yeah.
Yeah,
And
okay.
and I literally lifted him out of the bed and carried him, placed him on this table, and he's telling me where to place my hands, how to do all of this and get ready. And of course, the wrestling background, you're kind of getting psyched up for this
Yeah,
key
yeah.
moment, right? So you're going through all the motions, and I get him in the position. I think I've got everything right. I deliver the best adjustment that I thought I could do at the moment. And I thought I got it. And then he turned and looked at me, and he just cold looked at me and said, "You didn't even get close."
Wow.
And yeah, he didn't mix words. It was not good. And so I realized that I failed, and I just went home so sad that I had failed in that moment of need. And I just didn't know what would happen to him.
Yeah. Did you think that I mean, his life was at stake to an extent.
Yeah.
How much of that pressure did you feel was on you?
Oh,
and the fact that you
I
failed?
knew that. Well, he was so well known in the profession that I knew that if he passed away that night, everyone would know that I was the one that tried to step in at that moment and failed. And I thought, I'm going to live with this the rest of my life, my career. And he was a friend, he was a mentor too. So I had failed him, and he was such an important person in my life. That was the worst part of it.
Yeah.
And then professionally, what would follow? It's really it's
Talk about a
lot.
make or break moment for
lot.
life.
It was.
And that was
Yes.
right in the
Yes.
beginning.
Oh, it was
Because that could have gone, that
Yes.
could have so many different ramifications.
So the amazing thing, and it was such a key moment in my career and in my life, his daughter, Dr. Renee Kale, who also, of course, knew this procedure, they called her. She was in Atlanta. She flew in the very next morning. I picked her up at the airport. I am racing, just every moment counts, you know. And she gets to the hospital very calmly, coolly, puts him down on the table, delivers that adjustment, puts everything in place, and within 15 minutes, he is breathing normal, heart is in rhythm, everything is perfect. It
That
was
is
incredible.
incredible.
Yeah.
That is incredible.
It really showed me that this work, this technique, this procedure that he taught really worked, but I wasn't prepared and I failed because I wasn't ready.
Mhm.
And so that was a key moment for me too. And it really taught me so much in that moment that I
Right.
just needed that my preparation wasn't ready for that moment.
That's unbelievable. I mean,
Mhm.
how would you know if you're ready or not without
Mhm.
being the one to deliver? So I think that
Mhm.
the amazing part of it is that you stepped into that moment and you did it,
Yeah.
not knowing what was going to happen, but also
Mhm.
knowing that there was a good chance it wasn't going to work.
Right.
Which is, to me, that's like, that tension is incredible, and the fact that you did it is amazing,
Yeah.
and that you didn't shy away from the moment, even though
Yeah.
maybe you wanted
That's
to.
right.
I'm curious to know, like, what happens in that moment. And let me frame this as,
Mhm.
like, you're in this hospital
Mhm.
and there's a statue of a doctor who's treating Dr. Cal,
Mhm.
and there's all these people around, all these things.
Mhm.
Now, we're about to do an adjustment
Mhm.
that's going to have some sort of miraculous. I mean,
Mhm.
that's the way I see it.
Mhm.
It's not that it can't be explained, but it's miraculous. How do you explain it? What actually happened to him? Like, because what a drastic thing to go from that state to a complete different state from an
Mhm.
adjustment. And
Right.
what were doctors even saying about that?
Well, they couldn't explain it. It was amazing when she delivered that adjustment. It took all the pressure off of this upper cervical area that's so delicate and so important to life. And as soon as that pressure was removed, his body started to function normally. All the systems started to fall in place, and everything just went nice and smooth. And he recovered, and
Mm.
it was incredible. And after that experience, I realized that I really needed to become basically obsessed with learning how to do this work because I never wanted to be in that position again and fail.
That will leave an imprint on you for
Absolutely.
sure, in the most
Absolutely.
extreme way.
It did.
Yeah.
And it was such a key moment. I'll never forget it. And after that time, and he didn't know if he was going to live a month, a year,
Hmm.
or what. He said, you know, Dr. Eichen, I just don't know how long I'll be with. I don't even know if I'll be around to teach you the work that we had planned on. So you should look for another opportunity. I don't know if I'm going to make it for very long.
Mm.
So I ended up taking a opportunity in Virginia. I moved to Northern Virginia and I practiced there for 2 years. And during that time, I just became obsessed with learning the work, and I just day in and day out practiced and drilled, worked with patients, and I refined the technique until I became competent. And 2 years later, in 1999, he called me and he said, you know, I'm still here, I'm still working, and I'd love for you to come down and take that position that I originally wanted
Wow.
to. Yeah. So I got to move down in 1999 and work with him in the research center and work alongside of him and learn from him. And it was a wonderful opportunity. And I did have a chance, of course, to redeem myself at some point.
That's what I'm looking to hear. How did you redeem that situation?
Well, as circumstances would happen, he did collapse again.
Okay.
And this would have been about a year after I moved down and had been working with him and really learning, working side by side and really refining my technique and my practice. And I got a call from his wife again, Charlotte, and she said, Dr. Eichen, he has collapsed. He's on the way to Mary Black Hospital. We need you to get there as quickly as you can. And I was actually in Mauldin at his satellite office.
Okay.
And so when I got the call, I got in my car and I got as quickly as I could to the hospital. I think I actually beat the ambulance there. I was going
That's
so
amazing.
fast. Yes.
Well, you knew that
Yes.
you knew
Yes.
you were a little more prepared this time
Yes.
around, so
That's
you had to
right.
be there first
That's right.
and prove that.
That's right. And so it was quite a scene when I get there. I'm there with his wife, and she has this portable table in her hand, and she looks at me and she says, "You know what he expects you to do, and you need to get it done this time."
Yeah.
You know. So when he arrives at the hospitals, it was obviously in the emergency room. They take him straight back. His local cardiologist, Dr. Hearn, was there. with all the emergency room staff, and they're working on him, prepping him, getting everything going. And we're standing kind of back watching this whole scene. And at the time, she's standing there and she says, look, you need to deliver this adjustment and be ready. So I said, okay, you stand on the other side of him. And when I say now, you put that table against his head and I'll do the work. And so
Wow.
it was quite a moment. I didn't know what to do. I just knew I couldn't fail a second time now that I had another opportunity. So I literally jump in. I pushed his doctor out of the way, one of the nurses out of the way. I stood in, I delivered the adjustment, and I think I ran. I think I was actually afraid that I was going to get in trouble
Yeah.
for doing this. And I ran out the door. I didn't even know what was going to happen. But this time I didn't fail. I got it right. And he did so well, and he just recovered beautifully after that.
That is amazing.
It was.
Yeah,
It was
and
incredible.
I love how you could have run away the first time, essentially.
Yes. Yeah.
I mean, that was an option.
Mm-hmm.
And then the second time, when you redeem yourself, you ran away, but for different reasons.
Yes.
You were running from the handcuffs.
That's right.
You're not running
Yes,
from.
I didn't know if
from
I
the
was
situation.
welcome. And one of the best parts of that experience is that 2 weeks later, now he's recovered, he's back to work. And I knew that we had a new patient. I was informed there was a new patient in Dr. Kale's office, and to go in there, I would stand next to him and take the case histories and do the consultations. And so when I walk into the room, into Dr. Kale's office, the patient was seated in the chair, and I look over, and it's Dr. Hearn.
Wow.
Yeah. And he says, Dr. Eichen, I can't explain medically. There's no reason why Dr. Kale should be alive and sitting in that chair. I can't explain it. He goes, I don't know what you did to him that day, but I want it to.
That is amazing.
Yeah.
And it's interesting too, because in life, sometimes we don't need to know the answers.
Right.
But if you know you want something and you're just feeling called to something, you can't say no. And I think that's a theme for you and for other people, obviously, too. But you're not shying away from that. It's like this draw that almost you can't escape from.
Well, all of us are created the same. And because this area is so delicate and so important for our overall health. So just think of when we have the brain, people can have a head injury and actually have direct trauma to the brain, and yet we can still live and survive. But the brainstem area and this area in the neck is so delicate that if that area is damaged or injured, it's usually the end of life. And so actually one of the unique situations I had when my first practice was in Northern Virginia, it wasn't very far away from the Quantico Marine Corps base. And I actually had a few of the guys going through the sniper school that found their way to my office that had been hurt during the training. And I was given this explanation to one of them about this area, how important it was for health. And he looked at me and said, that's really interesting. He said, in the movies, you always see the sniper take a headshot and take that, target out.
Yeah.
He said, but actually, going through sniper school, they teach us to aim for this area of the neck for that very reason.
Is there any reason why we don't spend more time discussing this as a general health thing? Because I think that, I've had migraines. I was on Topamax for controlling migraines, and I was never really taught anything about, or there's no general health for the spinal stem or brain stem, I should say. It's just not really discussed. Is there a reason for that, you think, or is it just not something that's on everyone's forefront of their mind? I don't know.
Well, it's a great question. So many people, even today, all these years later, never heard the procedure, aren't familiar with it. Patients come in every day into my office and have never heard of this work. I think that social media, the positive side of it is that it's getting the word out. And so now people are sharing on social media their experience as a patient going through and getting care from another doctor that's certified or trained in this work, or any chiropractor where they go and have the experience. And so when I started in practice almost 30 years ago, that wasn't around.
Wow.
And so there was a lot of this anti-chiropractic sentiment back then, and that's really changed. And I think social media, to the positive side's really improved on that.
I love that. And I think sometimes you can't deny the power of someone's testimony, their story. How are you going to explain? You don't need to know all the answers, but you seeing Dr. Kale moving and fine, or you just me hearing this story
Yeah.
can't be denied. So yes, we don't know what it is, but I think what we need to do is let more people know about the fact that we do have these tools available to us, which is incredible.
Yeah.
So I wanted to talk about an interesting topic. I call it practicing what you preach, because I think as a parent, that's very important.
Yeah.
Just as a general rule for life, we're not trying to build credibility, but it does help people to know that what you're doing is not only working for them, but it's something maybe that you've dealt with in your life, so that if you're offering a solution, you can also say the solution worked for me personally.
Yeah.
So that being said, other than your skateboarding injury, back pain, knee pain, hip pain, anything that you feel is necessary to talk about, or
Sure.
you're perfectly fine and healthy?
No, I've had my challenges, you
Yeah.
know, and you're absolutely right. It's great because I've had my own personal experiences where I've been injured and hurt. In fact, because of that neck injury, you know, chiropractic helped me a lot when I was a student. I improved and felt much better after I got under general chiropractic care. But when I met Dr. Kale and he delivered that first adjustment to my upper cervical spine, it was so dramatic. And I felt immediately a difference. And all those years, this is 10 years later, you know, after that injury, and I felt a dramatic change in my health. I started to sleep better. I had more energy. I didn't even realize, I think my health had declined so gradually over the years since that age of 13 when it started, that, and I wasn't an athlete anymore. And so I just thought, well, here I'm in my early 20s. This is what being an adult is like. I'm just starting to feel run down and tired. And this is just what everybody else deals with, right?
Yeah.
And that's what a lot of people tell themselves. I just learned to push through it and live with it. And then one day he adjusted me and I just felt an immediate change. It was a huge weight lifted off of my shoulders. And I saw my health recover. And that's what made me so passionate about studying the work. Is I remember feeling like I crawled out of a hole I didn't even know I was in until I got out of it. That's the best way I can describe it.
Yeah, so I will say that makes sense to me, because the first time that I experienced any relief in this last saga of the back episodes that I've been having in pain management, the first thing I noticed when I got up off of your table was that I felt how comfortable my shoes were.
Yeah.
And I said, you know what? These shoes are really comfortable. And it was like this small little thing. I'm like, well, why didn't I realize? Well, because in the background of my mind, I was dealing with things that I just kind of accepted, like, oh, this is normal. I'm going to have this dull ache for the rest of my life, or for however long. But it does impact your quality of life more than you give it credit for, especially when you start to cope and think that there's no other way, which is not a fun place to be. If something's wrong, you want to know that there's a solution. And if you don't, what are you going to do? You're going to cope with it. And when you get into that place, which I personally would say that I was at, you start to slowly accept things not being as good as they should be. And then you miss out on things. And I don't think having the most comfortable shoes is the most important thing in the world, sneakers. But there are other things that start to escalate from there. How irritable am I just generally with my children or with my wife? And I'm not going to say, oh, I'm in a bad mood because my back hurts. You know, it's like, you don't want to make excuses, but in reality, it's true. Your quality of life, it's like the boiling frog, the frog in the boiling water. You know, it's slowly deteriorating you. So I can attest to that thing where you didn't realize how good it could be because you just didn't know that there was a way forward for you.
That's right.
Which is amazing. Any other issues that, like, so I struggle with pulling my back out, which is the technical term in the industry.
Right.
Hurting my back, walking hunched over is what I say. I call it that.
Yeah.
What is that? Like, what is going on when I'm hunched over like that? And have you ever dealt with that?
Yeah, I have actually. And, you know, I think as we all go through life, you know, we have slips and falls, injuries, stress. You know, our current life was just working on computers and being hunched over all day, like many of us do. And this stress builds up over time. And it oftentimes is gradual. Sometimes people can actually point to a day and said, yeah, I was in a car accident on this date, and that's when their life dramatically changed. And that happens too. But many of us,
That's
it's
not
a
my
gradual
story.
decline.
Yes.
And people don't realize until they come in and they get under care, And then all of a sudden, it's almost like a shock at how much better they feel. And it's really, that's one of the best parts of my job. I absolutely love to see people go through that process. It's really dramatic. And
Right.
so many patients, and gosh, sometimes I wish I had written a book, with all these wonderful patients that have come in over the years. But we just had a wonderful lady come in recently, a few weeks ago. We were talking that when she came in to see me, she had back pain. And that's what her consultation was about. That's all we talked about. But as a chiropractor, we really study the whole spine. But I started doing the general chiropractic because even general chiropractic is so helpful for so many things. And so I
that's
started.
just not focusing on a specific
Right,
area.
right.
Okay.
So, chiropractors help people all day, all over this world with just so many different health conditions. There's just different procedures that focus on different things. I realized that there was something going on with her upper cervical spine that she didn't really tell me about, but I'm there to treat everything, to try to get her the best recovery possible and get her health back. And so I started to treat her neck as well as her back. And after a few weeks, she came in and she said, what are you exactly doing for me? And I said, what do you mean? She said, I've had migraine headaches for over 25 years. She says, as a matter of fact, I went to Duke, I went to Emory, I even went to a headache clinic in Chicago, and I spent over $600,000 out of pocket.
Wow.
Yeah, can you imagine?
Yeah.
And they all said the same thing. We're really sorry, but there's nothing we can do for you. You just have to learn to live with it. And so she did. And so for over 20 years, 2 to 3 days a week, she was having a migraine headache. And so it just,
Unbelievable.
her quality of life was just terrible. So she used to love to ride horses. She couldn't do that. All these other things that we take for granted. She couldn't really hike without pain. So many nights she spent just in a room, quiet, with all the lights turned off because you couldn't deal with it. So all of a sudden she comes in for something completely unrelated, and I start to work on her, and these headaches go away. And then
Wow.
when she came in a few weeks ago, she said in January, this makes 2 years now in a row, she has not had one single headache.
And I always find that fascinating too, because as I've learned more about just chiropractic care and how the body is so connected in a way that I'd never really respected or understood before, it is unreal the amount of unrelated things that are happening in people's bodies,
Yeah.
which is what I'm fascinated about, because sometimes I want to be like, well, why did that happen? The same question maybe that she asked you, what did you do that fixed this? There's not always a specific answer, I would imagine, but I think that's the most craziest thing to me in the world is how are your migraines going away, but the body is really connected. I mean, I want to hear some more of these stories,
Sure.
to be honest with you, but before we go into the rest of the stories,
Yeah.
can you tell me a little bit about spinal decompression? Because I
Sure.
had no idea what that was. And as someone who can attest to its effectiveness, I almost question how could I have not have known about this for so long? But tell me a little bit about what that is and what's going on with that equipment.
Yeah, it's a wonderful tool that we use in the office. It's referred to as non-surgical spinal decompression therapy. So what that means is that, like in your lower back, when the spine gets injured, and oftentimes it gets compressed and squeezed, and it compresses these discs, which are in between the vertebrae that are filled with fluid, so they're kind of like a cushion or shock absorber. And when they get damaged, they can start to swell, and that's what's referred to as a disc bulge. And if that pressure continues and it gets worse, it can actually rupture, and that's what a disc herniation is. Now, once a disc herniation occurs, pretty much your only option there is surgery. And so when it gets to that point, it can be beyond what we can do. But so many people have these injuries where there's swelling of the disc, severe back pain, ruins the quality of life. It makes life very difficult to even walk or get through your normal days. You can relate.
Right.
And so this table is designed where people lay very comfortably in a very comfortable position, and we strap a patient in very gently, and it just decompresses by motioning back and forth. It actually stretches the joints and the ligaments. It actually creates a negative pressure within the disc to help draw that fluid in. It also increases the blood flow and circulation, which brings more oxygen to that area. So it really helps to speed up the recovery. And as a chiropractor, it really helps aid in what I do, speeding up the healing process.
Interesting. Yeah, this is all new territory for me,
Mm-hmm.
obviously. But one thing you said to me when I was in your office, which I
Mm-hmm.
thought was powerful, was it's not only going to help you relieve pain, it's not only going to heal you. So those are two very important things.
Mm-hmm.
It's also going to prevent something worse from happening in the future. And that's the thing that really got me thinking too, because I could tell the trajectory I was on wasn't necessarily great. Because if you're in really bad pain in any particular moment, think about how much worse that pain could be. And if there's something you can do to stop that, you should definitely be considering that as an
That's
option
right.
for
Yeah.
sure.
And it's a quality of life issue. And so oftentimes we have what we refer to as the need behind the need. So what I tell my
Yes.
staff is that, almost everybody coming in, most patients are coming in because they're hurting and they're in pain. And that's a terrible thing in itself, as we all know. But oftentimes when I do a consultation, I'll ask a patient, well, how is this affecting your life, whether it's at work or home? And, sometimes people have been putting up with pain for years, but then oftentimes we find that something recently has changed and now maybe they can't work anymore because it's progressed. So let's take maybe it's the fellow that is providing for his family and he can no longer work and do the job. And he's in danger of possibly losing that ability to take care of his family. Or maybe it's a grandmother that just wants to get down on the floor and play with her grandchildren or take a walk. There's all these things that happen to us, and oftentimes it's how it affects your quality of life that finally make us pick up the phone and call to get help.
Right. There's that breaking point that you are approaching slowly and it doesn't really bother you because it may be on the horizon, but once you get there,
Right.
everything is changes.
That's
So,
right. That's right. So that's what, when somebody comes in, I not only want to help them feel better and move better, obviously, that's our number one goal, but it's about trying to restore their quality of life and getting them back to doing the things that they really enjoy. Exactly.
So you're looking at them as more than just a body. They're a body and a soul. They're a person who has important things going on that you love, and that's why you want to treat them, which I think I felt that, and I could attest to that 1000%. But I do want to talk about Esther.
Okay. Yeah.
And I want to hear this whole story because I've been thinking about the little that I know about Esther for a while and really just kind of almost even meditating on what are we dealing with here with chiropractic care? What are we dealing with?
Yes.
This is it is incredible. It is incredible. So let's hear a
Yes.
little bit about Esther.
Oh, that very special young lady. I will never forget her family. And it's one of those cases that just stand out in my career. This would have been about 25 years ago. She was 10 years old at the time, and she was referred actually by another patient in my office that I'd helped. I think they went to the same church. Her dad was the assistant pastor of their church. But Esther, sadly, when she was born, she had a very bad brain injury. And so at 10 years old, when she came in the first day, from the brain injury, we knew that she had seizures. And I was told that she had anywhere from 60 to 120 seizures every day.
Wow, every single day.
Every day.
Yeah.
I can't imagine. And because of that, and she would just drop where she stood, they had to screw a halo helmet around her head. So literally, this iron halo was screwed into her skull so that if she had a seizure and she fell, she wouldn't have another brain injury from the fall because it happens so frequently.
Right. That
And
risk is high.
she was also nonverbal, so she couldn't speak. And she would really just stand there and kind of grunt and groan, trying to express herself. And she literally drooled, and the saliva is slightly acidic. And I literally looked at her chin, and just the skin on her chin was gone because of the acidity of the saliva.
Wow.
Because she just, yeah.
Yeah.
And so your heart just broke. And I can remember watching her mom fill out the paperwork, and Esther had a seizure right in front of us, on day one. And it just, allowed me to see what these parents, as parents, what they were going through. It just broke my heart for all of them. And again, you think, what can I do? What can I possibly do to help this child? But it goes back to the principle. And it says, well, my job is to look for any type of pressure interference along her spine that could be affecting her health and try to fix it. And then let her body do the rest of the work. That's really it in a nutshell. So we did our typical exam. We started the work with her. And I did the special upper cervical procedure that we talked about that Dr. Kale had taught to me. And we began to see her change. And within a few months, the seizure activity went down dramatically. And I ended up taking care of Esther for a total of 2 years until she was 12. And I don't think she had a seizure for the last year and a half I worked with her.
That is unbelievable.
Not one seizure. Her chin actually healed, so the skin came back. They actually were able to remove the halo helmet and
so she was not at risk at that point because the seizure stopped, obviously.
That's right.
That's unreal.
It was incredible.
Yeah.
And, I think the circumstances of the family, they were from Europe, and they had to go back. And it was really sad because we had grown, obviously, very close.
Sure, yeah.
After helping her through this. And such a dramatic recovery. And I thought, what's going to happen to her? And I always thought of Esther. And a few years ago, we're talking 15 years later, after they moved away, I get an email from her father. And he said, Esther has not had a single seizure all this time, but she tripped and fell and hit her head and went into a seizure. And this happened in England.
Wow. Yeah.
And so he said, they took her to the emergency room, and he's trying to explain to the emergency room staff the upper cervical chiropractic care that I delivered. And they just, you can imagine, they have no idea what they're talking about, understandably, So he said, is there any way you can find an upper cervical doctor near us in England? And I thought, oh my gosh, there's very few chiropractors in general over there. I was just hoping to find a chiropractor that could help her. And I went on to a resource of upper cervical practitioners, and I couldn't believe it's just a God thing. There was an upper cervical chiropractor 30 minutes away that was able to continue her care and take care of her.
Really?
Yeah, and helped her out.
That is really incredible. So that's something that you would never in a million years, and maybe I'm just speaking for myself, seizures, it's not something that I would put into my brain, in my head, that would be able to be helped in this way.
Yeah.
What are some other things or some other crazy stories or situations that you've seen and experienced personally so that we can all, and I could wrap my mind around how our bodies are so fully connected and there's just other ways of approaching our health?
Well, I think that some of the most unique cases involve things like trigeminal neuralgia. That's another very difficult medical case. People have severe pain in their face and in their jaw. It's a really difficult disease. And in fact, it's often referred to as a suicide disease because so many patients that have that diagnosis, there's just no help available. And many of them sadly take that way out because they can't deal with the pain. But this procedure is so uniquely suited to that area. So we actually have, I think, 2 cases right now coming in for that condition. They're doing beautifully. Actually, going back to the trigeminal neuralgia, I had this patient, the gentleman in my office, really great guy from Australia, really interesting guy, and he had responded very well to the care. And as we were leaving the treatment room and kind of talking about, I'm so happy, and I think the discussion led into the trigeminal conversation as we left the door. And I had a patient sitting outside. I think she was probably in her mid 80s, waiting for her treatment that day. And when we got in the room, she said, "You can help trigeminal neuralgia?" I said, "Well, we have in some cases, yes." And she said, "I have a daughter in Atlanta that has that condition. Do you think you could help her?"
Wow.
And I said, "Well, best thing to do is have her come up here." So sure enough, a few weeks later, her daughter, who I think at this time is in her early to mid 60s, came up from Atlanta. And as we went through her case study, we found out that she also had an aneurysm around the brainstem. and she had to have an emergency procedure done where they did a decompression surgery where they actually went in and removed part of her skull from the back of her head
Wow.
to decompress that area and save her life, thank God.
Yeah.
But when they did that, they also put a wire mesh over this area to protect her because now there was no bone where that was before the surgery. And she said, as bad as the trigeminal neuralgia was, that this wire mesh felt like 1,000 needles just stabbing her.
Oh, that's
And for
terrible.
7 years, she had lived like this. And she said it was just, I don't know how she did it. So she came into me, and again, this is not the typical chiropractic case you can imagine.
Yeah.
But with the background that Dr. Kale taught me, with his expertise and the cases that we treated, I was able to go into that with some confidence. And so I was able to treat her within 2 treatments, pain-free.
2 treatments.
2 treatments.
This is in the course of a week, 2 weeks?
2 days.
2 days.
Immediate change after the first one, and 2 treatments, it was gone. And so she goes back to Atlanta and came back maybe 2 weeks or a month later for a follow-up, had no pain,
Wow.
and just in shock that this worked, And again, sometimes even I'm just amazed at the changes that we see, because, you can't always predict how a patient's going to respond.
Right,
All I
absolutely.
can do is do my job and find this area where the interference occurs, treat it, and then watch and wait and see what happens and watch the patient recover.
Yeah, sometimes we forget that we're only human. And as a doctor in any field, you can only do what you can do. And sometimes that does involve, the process of waiting or a process of trying things and being able to say, we know that this might work, but, there's some things that we just don't know until we try.
That's right.
Which I think we should be giving us all a little bit more grace for sometimes in life itself.
Yeah.
But now in terms of long-term care, I think you hear something like that. 2 days, this thing goes away, which is, again, to me, the only word I could think of is miraculous.
Yeah.
2 days gone.
Yes. Unusual.
That is a beautiful thing. Was she worried that it was going to come back or that this wasn't a permanent thing? Should she have worried that? Should she not?
I told her, first of all, I wanted to refer her to a doctor that was closer to her in Atlanta. So there's that option available to her. But I said, if it ever comes back, call and come up. And you know what? I think it's been over a year ago and I haven't heard from her. And I think last I heard, she's doing great.
That is a beautiful thing.
Yeah. They don't always work out. That is an amazing recovery and very unique. But yeah, in her case, it changed her life.
Wow. That's amazing to hear. You have this sort of category of things that are way out there. We would never even consider, that this is a chiropractic treatment or something that can be solved through this. But what are the big ones though? Obviously, you have joint pain, you have back pain. I wasn't that familiar even with the migraines,
Right.
sinus, all of that. What's some other things that you've seen tremendous improvements or even minor improvements that you would not know on the surface?
Well, there's a whole classification of what's referred to as movement disorders. And that can be anything from Parkinson's, where patients have tremors, in their hands. And I've had some success as far as improving their quality of life. So we say we're not going to be able to cure that condition, obviously. But what we can do is maybe help improve their way that they walk and improve their gait so they're not shuffling. We might see a change in the tremors where they're not as severe as they used to be. Total quality of life. There's also a subclassification of that that's called torticollis. And there are children and adults that have this condition where basically their neck, in most cases, is tilted or twisted over their shoulder. And it can be debilitating. And not only is it painful because of severe spasms in their neck, but many of these folks as adults, they just get withdrawn socially because of the constant pull and the tremors. And so they just withdraw from friends and family, and it's really sad. And of course the pain is terrible. And so I had a lot of success with Dr. Kale treating these cases in the research center, and many of them continue. In fact, I think I was the only chiropractor listed on the dystonia website for South Carolina as an alternative. So they had all the medical doctors and neurologists and thank goodness for them because they give them a lot of relief.
Yeah,
But this is
absolutely.
just another a way that maybe they can get some more long-lasting relief without the Botox, without the medications, and a more natural approach. And so we want to try to work with their doctor, but get them some quality of life.
Absolutely.
Amazing.
I think pain management, I mean, living with pain, there's all different places you could fall on that spectrum. It is obviously not fun. It is not great. But if you don't have pain and you see someone with chronic pain, someone that I know comes to mind, and it is so sad to see, and it brings a perspective to your life as well. And we've had these discussions where you're like, man, I complained about that, but if I stepped into their shoes, I don't even know how I would live for a minute.
Right.
So I think one of the things that should be discussed more too in chiropractic care is chronic pain, because yes, we get it when you pull your back out, it stinks. It could be 2 weeks, it could be 2 months. But some people don't realize that you might be 2 years, or it could be something totally not like a back pain or something with your neck. When you're in that state for so long, it like drains your soul out of you.
That's right.
So this is healing on just so many different levels, honestly,
true.
which is amazing to see and hear about. Now, all of that's positive so far. It's really, really positive, optimistic stuff.
Yeah.
Now, let's dig in a little bit about some of the things that I'm also interested in terms of criticisms. Now, it all depends on how candid you want to get in this forum, but what are some of the major critiques and criticisms that you face in your field?
I think the main one, and it is a challenge, is that once you go to a chiropractor, you always have to keep going, and there's some truth in that. So I think back in my own personal experience, I had that terrible neck injury at 13. I have had great success with chiropractic care myself as a patient, and yet I still get ongoing treatment myself to maintain this level of health. Because if I don't get adjusted at some point, I start to have neck pain and headaches like many of my patients do as well. And so there is an issue that, it's not like I'm a surgeon where I can put rods and screws along the spine and just fix it to a certain place and it stays there forever. This is a bit different. And so we have to do the adjustments, and then hopefully they last as long as possible. But most people are encouraged to come back for checkups and get an occasional maintenance visit. And for me, I actually get adjusted every week to maintain it. But some of my patients, once a month, some of them a few times a year. Sometimes I don't see them for a few years and they're doing great and they come in. So everybody is different with that. But I would say that is a justified criticism that, yes, I wish it could last forever, but most of the time, no. You need ongoing care to maintain, just like with our health. You can't go to the gym and get in shape and get fit and feel great and then stop going to the gym. Eventually, you're going to lose the benefit, all that time and effort you put in.
Absolutely. Yeah, I mean, so maintenance as a criticism.
Sure.
You kind of think back and you're like, well, why is it a criticism? I guess it's inconvenient.
Right.
But are we prioritizing our health enough? Because you might be complaining less about getting your oil changed as you are about being a chiropractor. And no disrespect to whoever that person may be, because that could be me at some point. I don't know. It's like, I'd rather go get my oil changed, but not maintain my health. I think that's crazy.
Yeah.
But that's just human nature.
Right.
And it's funny that that's the first criticism that you thought of. Because I think in our day and age and in our culture, we want like the instant and the quick, and we want to just throw something in the microwave and be like, it's done, that's it. But I think there's something very, very valuable to this like mind-body connection and to this whole conversation that we have to take it seriously. Pain is the thing that makes us run to you or anyone or the doctor or whoever. But when we're not in pain, we should still take our health seriously.
Yeah.
That's a huge thing. But I feel like as a culture and as a society, we're definitely leaning more in that direction as a whole, whether it's longevity. There's all these different discussions out there, but people I think are okay with this thing of like having to maintain themselves more.
Yeah.
Any other big criticisms other than maintenance? 'Cause
Well,
maintenance is important,
yeah.
by the way.
I when I first graduated, again, 1997, it was a very different environment. There was still quite a bit of animosity between the chiropractic profession and the medical profession. And so I can remember very clearly, even in my own practice, I would occasionally have a patient come in, and I can remember one lady very clearly, and this would have been again, early in my career. And when she came in, I think I treated her maybe once or twice, and she started to feel better. She was very excited. A lot of chronic pain she was dealing with. But when I looked at her, I could tell that her entire left leg was swollen, like twice the size of her right leg. I checked her blood pressure. It was sky high, dangerously high. And I said, you really need to go visit your family doctor. I'm concerned. This is not okay. And I remember her reaction was, I don't want to go. You're helping me. I feel better. I hate going to the doctor. And of course, I'm a chiropractor, and I want to see people get well naturally.
Yeah.
But then there are times where this is going beyond. You're in a crisis. You need to go for emergency help. So I had to spend 20 minutes convincing her to go see her doctor. So she finally does. And I get a call from her a few days later, canceling all of her future appointments with my office.
Wow.
And I was really shocked. And I said, well, why? She was so happy. And she said, well, I went to see my doctor, and you were right. I was almost about to have a stroke. But once her doctor took care of the immediate situation, he turns around and tells her, if you ever go see the chiropractor again, I'm going to kick you out of my practice.
Oh boy.
Yeah, that's what he told her.
Yeah.
And so in order to stay a patient in his practice, she canceled all her appointments with me. And you know that statistically, about 50% of the time back then, when I would refer a patient back to their doctor out of some need or concern that I could see, that would happen. That was that common.
50% of the time.
Half the time.
Now,
it's different today. It's
Okay.
changed.
Which is
That's
great.
the good news.
That is the good news.
Yes. Yes.
Has it changed a lot,
Yeah.
or just enough to move the needle?
No, I think there's a significant change. I think that both professions, just like in my own personal experience, you know, I may have started way too on this extreme on the chiropractic end myself. And over the years in my own life, I've really seen the value and necessity for the great work that the medical profession provides.
Absolutely.
And because of that, I've learned to reach out more. I've learned to look for great doctors that are doing great work for their patients the same way that we try to. And so if somebody comes in and they ask me if I know any neurologists or orthopedics or internal medicine, you know, we look for those doctors that have the same concern for the patients that we do and have a positive or favorable view of chiropractic.
Right. Which
and
is
work
important.
with them. And there's a
Yes.
lot of them now. And so it's really changed. It's
That's
a
great
very
to hear.
different environment. Yeah.
Yeah, we all need to know our place in the
That's
grand
right.
scheme of things. And it's really easy for humans, I think, to position themselves against people. So, like, who are you? Well, I'm not that.
Mm-hmm.
But I think that's the wrong starting place sometimes, especially when, you know, we're all essentially trying to achieve the same goal.
That's right.
Why do you think that the patient that told her to stop coming to you, like, what's the thing, what do they say to her, this doctor, for example? Like, are they saying, don't go back to see Dr. Matt, the chiropractor, because he's hurting you? What are their reasons for that?
That goes back a long way, but there was a bias against the chiropractic profession, and doctors, when they were going through their training in school, were taught and given a very poor view of the profession of chiropractic profession. And so as they were going through their training in school, they were taught, do not ever work with a chiropractor or have your patients visit. In fact, it got to the point, you can look this up in history, but back in the late 80s, there was a case that was settled in the United States Supreme Court where the AMA, which is the American Medical Association, used to be a very big, powerful lobby group. All medical doctors back then belonged to it, and they were caught conspiring against the chiropractic profession.
Wow.
And it was a big deal back then. You can look it up. There's a lot of history that goes into that. And the net result of that, though, which I think is a good thing, is that after that all came out and was made public, I think the medical profession realized, hey, wait a minute, we've got to back off of this. And so in the 1990s, as I was going through in the early 2000s, I think there was a real change where they stopped really demeaning the profession. And so I think when you run into any medical doctors, nurses, or other health practitioners that started school after that period, I think there's a huge change, and that's why we see it now. And it's the same in the chiropractic profession too. To be fair, back in the early days of chiropractic, we were taught, don't ever send your patients to the medical doctors for anything.
Right.
And that's not healthy either.
Right.
It has to be a balance, as you said.
Yeah.
And so I think that now we see both sides working together more. And I think that's a great thing, because in the end, it's really about the patient and what's best for them.
Absolutely.
That's the key.
Absolutely. Now, I think that, me personally, I love the tension between things on completely opposite ends. I like this whole concept of being on earth as like there's hell on earth and there's heaven on earth, and we're here to navigate this whole entire mess.
Right.
I think of the conversation in form of like the form of art and science. I mean, I think it's easy to take the medical industry as a whole and say that they're on the science end. I think that's an easy one to classify, and we're not making categories for the sake of them. I think it's for this discussion. But would you say that chiropractic would be more on the art side? Does it fall in between an art and a science? How do you see that?
When we're going through and studying the philosophy of chiropractic, you really start to get an understanding of, how the innate intelligence in our bodies work, right? So, we can look at it from a religious perspective, as a Christian, and we can see that God has put in each one of us this innate intelligence, so that we always talk about, you don't have to think about breathing. You don't have to think about your heart beating. We have this nervous system that actually regulates and runs all these things when you're sleeping, when you're not aware of it, and it's constantly going. So if I were to cut my hand, I don't have to have any kind of educated thought about how to fix it. There's an innate intelligence within my body that's actually going to start a whole chain of events that's going to create, a scab, a scar. It's going to heal. I'm not even thinking about what's going on, but it's innate within me, right? And so the chiropractic perspective is that we try to work with that concept from the inside out, meaning that everything medical, right? You go to your doctor and they want to treat you. They're going to inject something in you. They're going to give you a medication that you take from the outside in. Does that make sense?
That makes sense.
When we adjust the spine, what we're actually doing is removing the interference to your body expressing itself naturally. So your brain, think of it like this: your brain has these mental impulses that go down the nerves through the brainstem and spinal cord and out. Whether it's a spinal nerve, let's say it goes out to my hand. So if I'm in my kitchen and I'm cooking and I'm not paying attention and I put my hand down on a hot stove, well, the nerve endings in my hand are going to pick up that heat, and it's going to give me this, that signal goes right up to the brain, and immediately the brain interprets it as danger, and then the brain responds to the signal down to the hand, and it's just quick movement and a reflex to save me from getting burned.
Right.
Right. But if there is a injury, or what we call a subluxation in the spine, and especially right here in the neck, and now all of a sudden that communication is affected by that, well, what I do is I put my hand on a hot stove and I don't feel it. And it just sits there and I get burned. So think about somebody with diabetes. They have poor circulation in the hands and feet, right? So if they put their hand down, that's what happened to my good friend from high school. My teacher, he cut his foot and he was diabetic. And when he went to his doctor, they just said, oh, it's just a cut, no big deal. Put a little salve or cream on, it'll be fine. But it got infected and led to a gangrene, and they took his toe off, they took his foot off, then they took the leg off, then they took it from here, and 2 weeks later he died. That's what
Unreal.
happened.
Unreal. So I think chiropractic care, the way I see it, is leaving room for the Holy Spirit.
Absolutely.
In a sense, right?
So, because it's about having faith that the Creator has a far better understanding of this than we ever will educatedly. Does that make sense?
That does. And we will be right back to the show. Most people create content, but very few leave a legacy. The Echo Podcast is where we take your story and turn it into a strategic media asset that works for you long after the conversation ends. Your story deserves to echo. So please subscribe to our channel and reach out to us if you would like to join us on the Echo Podcast. Enjoy the show. I'm going to share a little testimony of my own here.
Yeah.
You had given me some information that I requested about regarding spinal decompression.
Yeah.
Because I was flat out, like, never heard of it before. So I was curious. Before I looked at the first line of whatever was written there, what popped into my head was amazing. I had this thought and realization that, okay, our bodies know how to heal themselves. They do. We're leaving room, because I had this visual in my head of the spine decompressing as creating room for the Holy Spirit to enter in, and like for God to come in and do his work, that he gave our bodies the ability to know how to do that on their own.
That's right.
I wish I could remember the name of the book. My wife and I read a book, something about the miraculous body, or I need to find out what this book was. But it was the first time that I actually realized that we are created in such a way that we can heal ourselves, or at least we know how to.
Yeah.
And we need to foster this relationship, this thing going on between God as our creator, between us as experiencing this world and being in his image. It's really hard to navigate and understand, but the way I saw the real visual analogy of spinal decompression, which we are totally making spinal decompression a Christian thing right now. It's like, it is the Christian way.
Right.
You're like, you're making room for the Holy Spirit. But really, I mean, too, is you're leaving room for your body to do what God made it to do.
That's the key.
That's the key.
That's why chiropractic works so well. When we think of these spiritual things, that's one of the things I love about this work, because we have an absolute understanding of that principle as chiropractors. We see it every day. And so everything medical depends on the right diagnosis and the right treatment and protocol. They have to have everything right.
Diagnosis and protocol, huge. Yeah.
Right? If they get the diagnosis wrong, everything that follows is wrong. So you take that case, Kelly, that I mentioned with the migraine headaches. She didn't tell me that she had migraines, and I didn't have to do a differential diagnosis to find out what type of migraine she had. What I did was I found the pressure in her spine and I treated it.
That is
And when I released that pressure, her body did everything else.
right.
And she got well. You see, that's
amazing.
It is. And so it's an understanding that I always say this, as a physician of any type, whether you're medical, chiropractic, whatever, there's a real danger where you start helping people and they get well, and man, it can go to your head and you can begin to think that you're something.
Simon the Sorcerer.
Yes. And what I do is constantly I'm being humbled and realizing that I'm just a glorified technician of the spine, just like a great mechanic of a car or anything else, is I just am really good at finding these interferences in the spine and treating them. And I do a really good job at it. But it's really God's creation that does the miraculous part. And that's a beautiful thing.
That is, all right. The heart of why we're having this discussion is that right there. I walked into your practice for the first time and I felt something. I felt something amazing. I felt something comfortable. Something was going on there. And I could not put words into it. I just didn't know what it was. I wanted to sit down with you and find out what it was. And I thought of all the different ways to ask these questions to find out, because listen, there are so many angles. I mean, the conversation of business is sacred art. It can go anywhere, and we can talk about the technical aspects. How are you training your staff? Because, by the way, your staff also exudes this same atmosphere that I'm trying to get at. And I could say, man, how do you do it? And then you might say, well, this is our training protocol. This is how we monitor KPIs with them. And this is all that stuff. But what I'm just seeing and feeling for me personally is the answer to the question, what did I experience when I walked into your practice? I experienced healing, that's for sure, because it wasn't all smoke and mirrors. My life has changed since meeting you in a physical way, which is, I can't thank you enough for that. But what I experienced is basically a testimony of God's goodness lived out through all the stories and experiences of your life. But you also saying, I'm an instrument in your hand. That's the heart of what I experienced. because you can't really love people if you see them as an object, right? You can't really love people if you think you have the magic hands, which you might, and you do. I'll say it on record. Dr. Matt has the magic hands.
Yeah.
But how do you let that magic flow out through you? Because you're going to cut it off right at its source if your head gets too big.
Exactly.
Then you're going to stop loving people if your head gets too big. The story of your practice, for me, my experience of it was actually a living testimony, a living story of a man who has said, like, yes, God, I'm going to do this. I may not have all the answers. I may fail when I'm stepping into the ER to do an adjustment on Dr. Cal and blow it, completely blow it. But I'm not giving up. That's going to push me to learn more about this field. It's just that creativity and that deep passion to know more. Like, I want more. I want more of this. I want to know it. And for me to be able to verbalize that is a relief for me. Because to be honest, I was intrigued. I was so intrigued as like a business owner. I'm like, how does he do it? I was just I loved every little thing. And there's this place to talk about that, I think, for sure. Like your music selection. And there's so many things that I noticed that, maybe you didn't even think too much about it. But it was beautiful for me to experience someone who's on the right path, humble, open hands. I'm gonna do the Lord's work. I'm not wearing a collar as a priest. I'm not a pastor. I'm not a worship leader. I'm not whoever the religious thing is in your head, but you are doing God's work. You are healing people. He's healing them through you, and you're reminding all of us. Like, I think the heart of your ministry is you are reminding us as people that we're made in God's image.
Exactly.
You don't need to keep, and again, this is not anything to say about doctors or the medical field. You are not a slave to injections and pills. You don't have to be. And you probably, some people need these things. But you are fearfully and wonderfully made.
Yes.
Let's give your body, let's remind you of that. Let's try that. Let's try having faith. And a faith that's not dead, that's just sitting there saying, well, heal me, God, and I'm going to lay on my bed in agony.
That's right.
We're walking in faith that has arms and legs, and that's a real, true faith. That's the heart of what I've been trying to figure out the second I stepped into your office. So you're experiencing this. This is a real moment for me.
That's great.
So serious. I wanted to figure it out, and it's on the lines of something that is not able to be figured out, in a sense. Now, I wanted to talk about something that is a rabbit hole, but what's fascinated me about technology, because I've always loved technology, is you look at the medical field as a whole, and I think you could look at a lot of professions and say, hey, well, if we could just take a data dump of the brain, pull that in with pharma database, pull that in with this and that, we could kind of distill it down to an algorithm in the medical field.
Right.
In a sense. So take ChatGPT. It's like, can ChatGPT diagnose? I'm sure it could diagnose probably pretty well. Can it offer a treatment plan? I'm sure it can pretty well. But that's under the assumption that we're robots and that you can just take the hard drive and put it somewhere else and operate it off of electricity that's from your wall or from whatever, not the electricity that our bodies, as made in God's image, are generating it in our brain.
Yeah.
I think that our society really needs to go back a little bit. And I'm not against technological advancement. I use AI, for the record, I'm not against any of this, not against the medical industry. But I think sometimes we need to take a step back and leave that room for the Holy Spirit. Have you had any sort of spiritual encounters along these lines? And we don't have to go down the AI rabbit hole, but what are those spiritual encounters like? Because you're doing spiritual work.
Absolutely. No, it's many. That's why I stay humble, because there's a constant reminder that there's something bigger. It's not through me.
Right.
It's through
Right.
him. And if you can reconcile that early on, that's really important, because I've seen people crash and burn. Any physician, it would be an easy thing to fall into that trap because people are so happy. They've been hurting for years. I mean, there's this chronic pain, and then through your hands, they get well. I mean, that can get to you pretty quick if you don't know how to learn and navigate it.
Yeah.
And for instance, you, from a faith perspective, right? When it's everything you mentioned, and I really appreciate what you said about my office, because actually everything in there is done by intention. There's not a single thing in that office I haven't thought about.
We could go through a list of all of them
Yes.
at some point. Maybe not right now, because I've noticed a lot.
It's great, because what you're telling me is confirming that, you know, it's having the right effect, because I want it to be that place. And the other side of that equation is that, okay, so as a Christian, right? What do I do when people come in the office? As a chiropractor or any physician, I think our job is to not think about that person on the table, their politics, their faith, where they're at. My job is to do as much as I can to restore their health and get them back feeling as good as possible, right? That's my goal. However, I think that we are often used as an instrument to lead that path back to God, because again, they're searching for answers. So I can think of one person in particular. This is just an example of many, but where, you know, again, this patient came into my office. She was a friend of mine. And when she came into my office, she had no experience with chiropractic. She had been diagnosed with cancer 10 years earlier. She already outlived her diagnosis by 5 years. Okay.
Wow.
So she comes in, and she kind of knew from some of the things in my office, might see a Bible or a cross over here, that I was a Christian. And in her past, she had told me later on that she had a very negative experience, you can imagine, like many, right? Around
Many
the
people,
faith.
for sure.
And down here in the South, and been judged by a lot of people. But I never talked to her about that. I just took care of her. And I was there to serve her. And interestingly, though, our conversations led to find out that she had the same cancer as my pastor's wife, who had just passed away a few years before this. They had the same doctors and the same nurses. Now, we didn't know this yet, but we had these conversations. And one day she says to me, she says, you know, I went to this event downtown, and it was for the cancer patients and the staff in this area. You know, they were all so close going through this. And it was kind of a fundraiser and awareness and support for the families. And many of them had lost their partners or spouses, children, whatever. And this is a way they could get together. And she said, you know, there was a pastor that stood up and gave a message. And I don't know who he was. I don't know where he was a pastor, but I could go to that man's church.
Wow.
Found out later that was my pastor.
Really?
Yeah. So here's the amazing part of that. I treated her for a few years, and we developed a very, I would say, friendship.
Yeah.
As much as you can be, right? In the office setting. It was a little bit unusual because I was friends with her partner. But she and I developed a real respect for one another. And then her cancer took a turn for the worse, and the medication that she was on stopped working. And her health declined very rapidly. And so here she was, stable for like 10 years. And then all of a sudden, within a few months, it was not good.
Wow.
So we had this relationship forming, and she trusted me, is the bottom line, because of what I'd done for her and out of just my service to her. And so we had found out all this unique stuff out, that that my pastor was involved with the same group of people. And so one day she was in my office, and she said, you know, I don't think I'm going to make it. And she said, what do you think happens?
Wow.
Sorry. I learned this a long time ago. I'm like a conduit in between. I realized that me specifically, I feel like I'm a connector. And I've seen that in a lot of ways. And so when she asked me that question, I said, well, you know, would you like to talk to my pastor? I said, yeah. 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 I said And they did. They got a chance to meet.
Did she know, did she put it together that that was your pastor?
Oh yeah, we talked about it.
Yeah,
You know,
okay.
we had figured this out before. So I called my pastor and they met, and I talked to him after. He said, I don't know, you know, where she stood at the end of it. I wish I could say there was a conversion and all this, but you see, that's not my job.
It's not, yeah.
And my job was to get her to him, and his job was to lead her to Christ. And he tried to do that. And then she passed away a few weeks later, you know, and where she was or where she stood at the end of her life, you know, I don't know. But I realized that had I not developed a good relationship with her, had we not built the trust between us, if I had maybe tried to hit her with scripture when she walked in the door the first day, she would have walked out.
Absolutely. Could
And
have
so
been, for sure.
this was just a way that God used me in that relationship to that point, be able to turn her over to somebody who was qualified to have that conversation.
It goes back again
See what I
into
mean?
being in the right place. Everyone has their place,
Yeah.
and there's this big connection
Yeah.
here on a spiritual level. That's a you cannot understate. And if anyone's not been in that position where you're talking to someone who's dying
Yeah.
in that way and asking you those big questions,
Right.
and you're the one there to answer,
It's heavy.
that's a heavy, heavy weight.
And you're exactly right. And I learned a long time ago, my job, the way I see it, when I go in my office, I'm an encourager, and I'm there to love and support them.
I can testify to feeling that
Yeah.
to the fullest extent.
And, you know, it, if what it's funny, I was telling Anna this on the way, it's a funny little saying, but it was something about people don't care what you know until they know how much you care. And that always
Absolutely.
stuck with me. So I was like, if I can, by example, just be there to serve them, then maybe these questions come out later, and they do.
Right.
And there's a place for people to have, you know, I'm right down here. I live downtown. You know, my son went to Bob Jones University,
Yeah.
right? So, you know, so there's that side of the equation where I'm walking downtown and sometimes I see the street preacher on the corner, you know, and they've got the microphone and they're shouting out, you know, and I'm like, you know, that probably there's a few people that are walking by at the right time and they talk with him and they lead them to Lord, and there's a place for that, but that's not my place.
Right.
It's not who I
Knowing
am.
who you are in God's story.
And so I found out a long time ago that that's where I'm at. I'm there to try to restore their health, be somebody that they can trust, that they look toward for that. And then sometimes, because you do lead them through this process and sometimes years and years of pain. And then when those questions come up and they ask, you know, then my job is to point them in the right direction, say, you know, I can share with you my experience, and sometimes I do if I feel like it would help. But usually I'm like, let me encourage you to go seek this out and talk to this person. And that's where I fit in.
These people are being primed for years and years, and God knows when someone needs to meet you with your gifting, just like all of us.
Yeah.
So to be able to humbly say, like, this is, you know, understanding my role in God's story, that's incredibly, incredibly important.
Yeah.
And there's no better way to show unconditional love than to treat someone, to heal them, to suffer for them, no questions asked.
That's it.
And that's how it should be. I mean, Jesus himself has modeled that, I believe. You know, for someone to be healed, they didn't have to pass a doctrine test.
That's right.
There were questions about doctrine that were framed and put against people in different situations. But for someone that needed something, they got it. You know, they got it. And that is incredible for you to be able to do that. Dr. Matt, tell me a little bit about what legacy that you're trying to build and leave here in your practice.
You know, that has really so much to do with my son, Isaac. And to really discuss that, I really want to go back to even before he was born and God's promise to me about him and his life. And in my walk, I really only feel like I've maybe heard directly from God twice on 2 occasions. and not in a physical, like an auditory voice, but a very, very strong feeling that I felt that God was speaking to my heart. And one of those was about my son. And it was during those early years when I was a new Christian, and I was very excited about my faith and wanted to share it. And all these things were happening in my clinic and in my office. And at the same time, being that conduit, I probably led over 100 of my patients to church.
Wow.
And they saw this excitement in me, I think, and my faith. And they were like, where do you go to church? I said, well, come with me. And so over a couple year period, I think there was probably over 100 at some point that had come, just maybe once, some more than others.
That's amazing. Yeah.
And so at that time, my pastor came alongside, and we were very good friends at the time. And he said, you know, Matt, I think you have a gift for evangelism, and I really think you should pray about becoming a pastor. And my initial reaction was, I don't want to be a pastor. I love being a chiropractor, you know? And I felt that was my calling, but at the same time, he was my pastor.
Yeah.
And he was my spiritual father, and he baptized me, and we had this relationship. And so I didn't want to just say no to him. I thought, well, it's worthy of consideration and prayer. And if he sees this and he believes strongly, then maybe I should consider it. So for many months, actually, I thought about this and meditated on it. And I remember very distinctly, I was in my shower, and if being a father of 5 as you are, right?
Yes.
You know you have very little time to yourself.
Sacred space.
Yeah.
That shower
And
time.
I think that because of that, that's probably why this happened, you know, where I'd have these moments, you know, where you're finally, you know, quiet and alone. So this was one of those moments, and I was in the shower, and this came up in my mind, and I was thinking about, you know, what my pastor had said and his encouragement. And at the same time, I loved what I was doing as a chiropractor. So I remember praying, and I remember telling God, okay, if you want me to leave the chiropractic profession and go into seminary and study and become a pastor, I'll do it. And do you know, after all these months of on this issue going back and forth, there was just this immediate feeling of no.
Wow.
I had this immediate feeling of, and it was like God was saying to my heart, that's not what I have for you. You are right where you belong as a chiropractor, but you're going to have a son one day, and he's the one that's going to follow me.
Wow.
And it
Wow.
was such a powerful moment in my life. I remember walking out of that bathroom, and we weren't even pregnant. We weren't even considering having more kids. So I had 2 daughters, you know, and I had this discussion with my wife, and I said, you know, I think God's telling me we're going to have a son. And it was so strong that I remember I had my insurance, you know, like most of us do with health insurance, and we didn't have maternity benefits, you know, on the plan.
Yeah. Yeah.
And I was like, we better do this. I mean, I think this is going to be a thing. We better
Yeah.
do it. And so I can remember calling, you know, Blue Cross Blue Shield and getting the maternity benefits on. And they said, yeah, you got it. It's a 12-month grace period and all this and so forth. I'm like, well, it's God's timing. And sure enough, 8 months later, found out we were pregnant.
Wow.
And I knew immediately. I was like,
Yeah.
it's a son. I know it. And of course, you know, you wait 3 or 4 months, and you go have an your ultrasound and get it confirmed. But I knew, and it was, you know, of course.
Yeah. And it
a
all
boy.
was going that direction,
Yes,
right?
that's right. And so, you know, Isaac comes, and we named him Isaac because he was my son of promise from God.
That is beautiful.
Yes.
That is incredible.
Yeah. And he has been his whole life, he's just been this amazing young man. I have never had a moment where I had to discipline him or and that he had been disobedient in any way. He's always been this incredibly wonderful young man, and so thoughtful and caring, and he's an amazing person. And I always tell everybody, I can't take credit for the young man that he is, because I truly believe God has had his hands on him from the moment of conception on.
Yeah.
He's been this way. And he even led one of his best friends to the Lord on the playground in the first grade and didn't even tell us.
That's when you know.
Yes.
When you hear these stories.
I get a call
the
from
playground.
Yes, I get a call from this
stories.
young man's parents, and they're crying and thanking me. And I said, when did this happen? They're like, oh, a week ago. And he hadn't even mentioned it. You know, he's just that kind of young man. So his whole life, I just assumed that this is what God's plan was for him. And at the same time, I didn't want to put an expectation on him and make him feel like
It's tricky to navigate.
he was being forced down this road. So I never discussed it with him. I never told him.
Mm-hmm.
I figured God would lead him.
But that's an act of faith right there.
Yes.
Yeah.
And so, interestingly, years go by, and when he turns 16, and he's at Bob Jones, the academy, a Christian school here locally, he says, you know, Dad, I'd really like to work in the clinic. And I said, you would? And I was pretty surprised. I was like, okay. And I thought, well, he's 16. Maybe he wants to make some extra money. He's got his driver's license, you know, and so forth, you know. And I said, well, sure. He said, well, no, I think I might want to do this as a profession.
Wow.
And he tells me that's 16. So I thought, well, I was kind of confused, because I thought, you know, one direction God had for him. But he decided that he wanted to be a chiropractor. And so he started working with me in the clinic, and he has continued to do that. And now he's 22. He just got his bachelor's degree in December, and he started a chiropractic school at Sherman College in Spartanburg last month in January.
Wow. Congratulations. That is incredible.
It is. He is a really special young man, and I'm so proud of him and the life that he has led. And he's just been great. He's been in the office. He knows how to run the front office. He understands insurance. He got a certification to take x-rays when he was still in high school, went through a college course to get this license to do this. So he's had this incredible background and understanding, and he's already so much further ahead than I was at his age. And so when you talk about legacy, you know, before all that happened, I was just happy being the chiropractor in Mauldin, kind of doing my own thing in my clinic and taking care of my patients. And I thought, well, one day I'll just retire and that'll be that. And now that he has shown this interest, and it's never wavered, he has been down this path now for 6 years, and he gets more and more excited about it all the time.
That's beautiful.
And so it's transitioned, and now the legacy is that he's going to come in and work with me after he graduates. And then all this, one day he's going to take over, and he's going to be the Dr. Isaac Eichen that will continue.
That is incredible.
Yeah.
So in terms of passing on the torch to and legacy in this whole discussion, it is one thing to pass the torch on to one of your descendants who fills a seat for you, because that happens.
Yeah.
But it's another thing when it all started before he was even born, and you heard something from God.
Yes.
That's why it's just so incredible and beautiful, the story, because he's not only performing a function, you know, I guess another way of saying it is that we need more chiropractors. We need more people to do this healing work, but someone who's learned the trade from you in a sense, but also has your same spirit.
Right.
Right. I think that's where that sees himself potentially as a conduit or a connector or something similar, but different. That's what is really, really cool about the legacy, because it doesn't delete anything. It just continues it like seamlessly.
Yes.
For you.
And I think he's going to far surpass anything that I've ever accomplished. I truly believe he will.
Yeah, which is the greatest honor as a father. I mean, my oldest is 10 right now, and just the thought of him doing something better than me, I'm like, I can't wait to see that.
Yeah.
Because it almost like expands your own purpose and gets you out of your head, and it's an amazing thing.
Yeah.
Is there one area that he thinks is more interesting than another, or he's just absorbing it all right now?
He's absorbing, and I've encouraged that. And I said, you know, this was the path that I took. And so he sees my areas of interest, and he does absolutely want to study the upper cervical work that I have, which of course I want him to. But I also told him, look, there are many, many wonderful techniques within the chiropractic profession. wonderful areas of interest that he can follow. And I said, I want you to pursue any of them that you feel led to do. I want him to have his own path. I don't want to try to force him down the same path. No, he may be called to it, but I want him to make that decision.
Yeah.
And so for me, it's such a joy because up until a month ago, he's been working with me in the office. Even while he was in college, he was coming in part-time a few days a week, and it was so wonderful to see him in the office. And of course, my wife, Anna, that you met. It's hard to explain what a joy it is for me to feel like I'm doing the work that I was created to do, and then to share that with my wife and my son.
That is unbelievable.
It's the greatest
Can't
gift.
get much better than that.
It doesn't.
Seriously.
For me, it's the
can't,
greatest.
right?
It's the best.
That is awesome.
That's why I think when you talked about the feeling you felt when you walk in that office, it's because of that. It's right where I'm supposed to be. I have a beautiful wife that I absolutely adore. I have a son that's following in my footsteps, and I get to share.
Yeah.
So these conversations that we're having, these are things I get to talk to my wife about, and she's there with me.
Incredible.
And sees these things happening, and so we get to share in that together. My son is there. He understands this work.
Yeah.
It's truly a gift. It's a blessing. It's so wonderful for me.
Beautiful.
That's why I love what I do, and I still love it every day.
That is awesome.
Yeah.
At this moment of your life, how this is all blooming and unfolding, I cannot thank you enough that you are here discussing this with me. Honestly, this has been a lot of fun. It's been a pleasure, but it's more so that of the timing. It's right now that I felt it. It's right now that all these things are happening in your own life and your practice, and even in my life and things going on, which is why it's very important for me to hear, and very encouraging for me to hear as well. So I wanted to thank you from the bottom of my heart, really, for having this conversation with me and opening up. And I thank God that I figured out the thing that I was trying to find, which was, I'm not going to find the answer other than the answer is, I just walked into a God thing at its peak, and it will continue to peak. And I hope the best for you. And I know the future for you and Isaac will be incredible. So thank you again. Let's just take a minute to tell people how they could find you if they live in the upstate area, or just your digital presence.
Sure. Yeah, they can find us at themauldin.clinic.com. That's our website. From there, you can find links to our social media like Facebook and Instagram. I think we even have some videos on YouTube available, but they can certainly find out all the information on our website about what we do, the services we offer, how to make an appointment, come in to see us, and mainly just have a consultation. Come in and just find out, can we even help you? Do you have a case that I think we can do some good work for you and help you with your quality of life? And there's never a charge to come in and find out and have that conversation.
And my encouragement to anyone on the fence is leave room for the Holy Spirit. Come on. No,
Exactly.
There's nothing that, there's no other way sometimes than just getting back to basics. And it's God made us in his image. And I just love how that whole discussion unfolded. So thank you again very much.
Thank you.
A whisper in the quiet of my soul, a promise, an answer, a spark lit dim, the breath of life filling me till I overflow. What is man that you are mindful of him? We all have our demons, our fears and our failures, the changing of seasons, endless healing in dry valleys where the flowers never grow. More grace than you will ever know. The fire and the floods rebuild me inside.